What kind of surprised you about psychiatry?
Just the variety within it, actually. Like in medical school, I think most of my placements, as I say, I did the forensic placement and then they were general adult psychiatry placements. And I think I hadn't quite appreciated what else psychiatry encompasses. So throughout my 3 years of training so far, I've had placements in learning disability, I've had a placement in kind of child and adolescent mental health, I've had one in perinatal psychiatry, which was something I hadn't even really thought about, but actually, of course, like pregnancy and birth is a really high risk time for people's mental health. And I found that really fascinating. I also really valued kind of continuity of care with patients. So for me, I think even during medical school, the things that I was considering was either something like GP or psychiatry, because you get to see the same people over and over again. Whereas obviously things like A&E, for example, you don't really get to see the same people. It's just you see them on that day and then you never really see them again. So that was another thing that really kind of drew me to the specialty.
I know a lot of people who kind of think about doing psychiatry, especially as a medical student, might have concerns or worries about losing sort of the medical nature of the degree. Do you have any kind of thoughts about that? Or
I can see why people have a misconception that they might not use their medical skill, but I think that's actually quite false, and you rely on your medical training a lot during your psychiatry.
I think it's really important to talk about the emotional impact that psychiatry can have. Do you mind kind of talking a little bit more about your own experience with this and a little bit about how you manage your own mental health?
Maintaining a good work-life balance is essential. You know, putting your all and trying your best while you're at work is, you know, you should take pride in what you do and enjoy what you're doing. But I think it's also really important to maintain interests and relationships and hobbies outside of work in order to kind of offset and kind of diffuse some of that stress. I myself, I'm into horse riding and I like swimming, but you know, whatever it is that you're interested in, whatever helps you to de-stress is really helpful. I also think within the training programme, in the first year of training, there's something called balance groups, which is kind of a reflective space where a group of CT1s led by a facilitator with experience in psychotherapy, you actually debrief difficult situations or difficult patient interactions that have either brought up strong feelings for you or you found particularly difficult. And the focus of that is not to focus on the medicine or the clinical case, but it's actually to focus on your own emotions and kind of explore in a group setting why it may be that interaction brought those emotions up for you and what does that mean and how can you best manage them. And I think that's in the training programme in order to help you develop skills that you then later need to use in psychotherapy, when a lot of psychotherapy is kind of being aware of the concepts called transference and countertransference, but essentially the dynamic between yourself and the client, you need to be attuned to that. And I personally have found as well the training that I had in psychotherapy, I've been able to implement in my actual day-to-day consultations, even after finishing that psychotherapy post.
What sort of things would you advise as kind of medical students, foundation doctors, junior doctors to do to sort of strengthen their application for psychiatry?
I think the most important thing is to try and gain as much experience as you can, whether that's going onto the wards, whether that's working in the community.
And in terms of kind of the job itself, what would you say are the sort of more demanding aspects of it?
The most demanding things, I think, are just obviously it's really emotional a lot of the time as to what you're talking to patients about, and it can be quite a kind of heavy emotional burden, and being able to try and support people through that. I think in order to be a good psychiatrist, you need to have empathy, you need to be caring, you need to be genuine. But with that comes, you know, you really feel for your patients and want to help them in the best way that you can. And obviously, if there's kind of medical and psychological issues, you want to do that. And also trying to help with the social issues as well as much as you can is really rewarding.
How do you sort of balance having empathy without taking too much on yourself from what your patient is saying?
It's important to be empathetic, and I always think, what would I like my you know, if I was in this situation or my mum was in this situation, what would I want from services, or how would I best be supported? So I always try and emulate that in consultations that I have with patients. But I also think being able to kind of debrief, or being able to kind of talk to people about when you are struggling, and seeking that support early is something that's really helpful. And I think that can be sort of more formally in things like balance groups, or, you know, in the psychiatry training, you also have allocated supervision. So you will have an hour a week one-to-one with your supervisor, which again, I don't know if that's common in other specialties, but that's something that is kind of mandatory in our training. I think that's really helpful to help you kind of navigate how to cope with psychiatry training, I guess. You know, speaking to your supervisor who's been doing it for many years, they will have a lot of advice and help and support to help you then develop your own ways of dealing with the job. Something that I really value about the core psychiatry training programme is that we have kind of 4 hours a week of local teaching time that is completely protected. So you always get to go every week for the full length of teaching. And then in addition to that, there's also a teaching day roughly about once a month or once every couple of months, where it's actually a regional teaching day. So you actually get to physically meet people from all over the deanery, which is really lovely.
You're a liaison psychiatrist.
That's right.
Kind of what's the brief summary of that role?
Sure. So liaison psychiatry actually covers a lot of different things. So liaison psychiatry basically means the interface between mental health and physical health. So I work on a small inpatient unit. It's actually the only one in the country, where we help people who've got really high levels of disability, from persistent physical symptoms, medically unexplained symptoms, chronic fatigue, or where they've got a long-term health condition like diabetes, brittle asthma, Crohn's disease, things like that. In medicine in general, but especially in psychiatry, your ability to see things from different perspectives and to put yourself in the patient's shoes, and to really understand what they're going through, what's brought them to that point, that consultation. It's incredibly important for psychiatry. It's the difference between a good psychiatrist and a great psychiatrist. And the core psychiatry training programme was, and still is, incredibly supportive and flexible. And so, you know, if I needed a bit more clinical time, I could say that to a supervisor and go, I feel like I need to know more about this, and they'd help me find the opportunities. Similarly, I want to do this teaching project, there would be support for it. There was support to fill out the portfolio and support to pass the exams.
Do digital kind of innovations have much of a role in your day-to-day job?
For me personally, it's not a huge part, but it is a really exciting area. You know, I have friends and colleagues who are exploring the use of artificial intelligence and app-based programming to help patients on a more day-to-day level.
Great. So when you see a patient get better, how does it feel, and what do the patients tend to say to you?
It is hands down the best feeling. Whether you're working in acute psychiatry or, you know, acute inpatients or crisis, or, you know, you're working in community, seeing that progress and being part of that journey, it's just incredible. I think one of the things that was a bit of a myth when I was at medical school was it's a group of patients that will never get better. But actually that's actually the minority. And even when somebody has a really chronic, severe and enduring mental illness, there are margins of improvement. Every single patient's worth it. And one of the great things I think about psychiatry is that because it's such a supportive specialty in general, that, you know, if I am stuck and I need some extra support from my colleagues in London at the Maudsley, I know that I can say, hi there, can you give me a hand? And they'll help.
Yeah.
And it's because you're not just working to treat somebody's medical problem, you're working to get somebody's life back on track. And there's nothing that bonds people together more than that united goal.